Hello, this video is a continuation of our personal care skills. So referring to our list for skills practice, this video will include protective devices as well as putting anti-embolism hose on a patient. Let me just set this to the side. So first, I want to talk about protective devices. That is a fancy or another way of saying a restraint. So we have to know as a nurse, when is a restraint appropriate? When is a restraint needed? First of all, you have to have an order from the healthcare provider for a restraint to be used. When my client is using that restraint or protective device, it is for their safety, and sometimes it could be for the safety of others. It would never be for the nurses or the staff's convenience, okay? So, here we have a client in a wheelchair, okay? So you'll notice there's a cushion right here. This is called a lap buddy. This lap buddy is kind of like a little table for the client. This is considered a restraint in that it would prevent my client, if they tried to stand up from the wheelchair, this would be in the way. So it is restraining them, it is preventing them from getting up and in some cases from falling. Now, the thing to always remember, a restraint is only a restraint if it is preventing my client from movement that they normally have to begin with. So, what if this is Mr. Brown? What if I came to Mr. Brown and I said, show me how to take this off? If he can remove it upon command, it is not considered a restraint because he's able to remove it and get up and move as he wants. However, if he cannot take this off upon command, it should be in the client's record, there should be an order for this to be a restraint. And don't get that confused because I have worked with clients who have some cognitive impairment, like maybe dementia. And every now and then they do work this loose and they may throw it at you. Well, even though they got it off that time, they can't take it off every time upon command. So it's just real careful that you understand what's classified as a protective device or restraint. The other thing to always keep in mind, a wheelchair. Did you know a wheelchair could actually be considered restraining a client? You'll notice here on the side, these are the brakes for the wheelchair. So you have one right there, and then you have one right here. Okay, so that keeps the client from moving. So let's just say this client normally got around by putting their hands here on the wheels, and they would move throughout the facility using their hands, but they can't because you've locked the wheelchair. That is considered a restraint. Now, if they can reach down and unlock it themselves, and then move about, it's not a restraint. So be real careful about that, because in this situation, if they had this lap buddy on and I put the brakes on and they cannot undo either one, I have actually double restrained, and that is a big no-no. Okay, so just a couple of things to keep in mind with that. So now I'd like to go over to our client that's in a bed here. This particular client, this is an example of a wrist restraint. This restraint actually could be used on the client's leg as well. So when do you typically see this? Well, it may be that maybe this client had like a feeding tube, or maybe they were actually on a ventilator, a breathing machine, and they had attempted to remove those tubes. Well, you know, that could put the patient at harm. Maybe they're confused and they don't really understand what they're doing. So that's typically when you would receive this type of protective device using. Now, one of the things I want you to notice is be able to fit 2 fingers underneath the protective device, because I've got to make sure that it is not so tight that it's cutting off circulation here at this extremity. So when I am feeling on my client's hand, you know, is it warm to touch? Is there still a pulse there, you know? Is it turned pale or discolored from lack of blood flow? Those would be immediate emergency situations to handle. You'll notice that this restraint, see, this is keeping them from being able to move their hand very far. Now, if we were trying to prevent, like in this case, maybe a gastrostomy tube that's at their stomach, this would be appropriate because they can't get to it. Now, sometimes it may have to be even tighter where they can't, you know, move it this far off the bed. It just depends on the situation. I do want you to notice, and I'm going to lift this so you can see, underneath here, this is actually tied to the bed frame. The bed frame is an immovable part. That means a part that does not move on the bed. You always attach or tie a protective device to an immovable part. Because see, a side rail would not be where you would want to tie one. Because what does this side rail do? It moves. So that would change the position of the restraint, okay? Put that back. Okay? You also notice this right here is called a slip knot, okay? So this is used for an emergency procedure where, oh my goodness, I need to release my client. I pull it, they're released, okay? So a slip knot is shown in your textbook. So what I was talking about a while ago, like let's say I don't want them to be able to lift their hand very high. I'll do that really tight like that. Come around and I just loop it. And then I secure, and there's my slip knot. And then I can immediately release it if needed, okay? So because you always want to be able to take the restraint out, release it just like that. We're going to go to the other side of the bed to look at a different type. This is actually what I have been seeing in more facilities now if they use a protective device. And the thing is you don't see protective devices used that often. Here you have foam. Still I can fit my finger underneath there, so I can adjust that. But you'll notice here, it just has a little buckle attachment, see? So let me make sure you understand what's going on. So this part is attached to their wrist. It could also be used around their ankle. Same thing though, right here, and I'm gonna undo this so you can really see what's going on. This part with the buckle here, I actually took and found an area of the bed frame, non-movable part, and then I just loop this through like that, and then secure like that. And then as far as distance that you're wanting them to be able or not be able to lift their hand, you can tighten this up to restrict movement as needed there. Always, always, always check about circulation. Also in this video, this is not a protective device as far as considered a restraint, but I did want to show this. This is just a heel protector, okay? So you'll see how nice and soft that is. Okay, you may see like sheepskin. This is more of a cottony type, but this is designed to protect the client's heel, because this is an easy area to get skin breakdown, develop a pressure area. So this is placed on their heel, but then look here. This strap does not need to be cinched so tight. Look, if I can't fit my finger under there, you could actually cause breakdown with that device. So you always want to make sure you have it, but see, I can fit my fingers underneath there. So just wanted to show you that because you may see that at a facility as well. Now I'm going to come to my box of protective devices, and I'll come back to this area so you can see what else I have here. Okay, so we'll just use right here at this area. This is an example. This is kind of like a waist restraint, and if you think of this as almost like a seat belt for the client. So this, a lot of times you may see a client is in a wheelchair. This is placed around their waist. This goes to the back of the chair, and then you would just do that slip knot for that. This is called a pelvic restraint. You will notice the front, the part that goes here, fits like that. This goes posterior to the back side of my patient. So it actually fits like a pair of thongs, okay? Wide front, skinny in the back, and then you just use your slip knots and tying those as well. You don't see these devices as much anymore, like I said, but We never know, you may come across those. Lastly, I would like to talk about the anti-embolism, or sometimes we say TED or TED hose. We have tried to go away from saying TED or TED hose because that's just a particular brand. So really the correct terminology would be an anti-embolism. So these are ordered for your clients. It will help with blood flow in their extremities. We're trying to help those clients that may be at risk for developing what we call a deep vein thrombosis, a DVT. So there are different types, okay? So this one here that I have, this one is a thigh high. It goes all the way from the client's thigh to their foot, okay? You'll notice it's rather long. If I hold up this one, see how short that is? This is a knee high. So it goes from the knee to the foot. So when I am determining what am I going to put on my client, typically it's ordered, thigh high or knee high. You'll see how that is specified from the healthcare provider. The other thing is you'll have to do measurements. You don't just walk in there and you see the client and, oh, I'm going to put a regular size on them. When you get the packages that these come in, they will have sizing charts. And I will tell you, every company, that chart may vary some. So for example, the thigh high, you would actually measure the circumference. That means how big around the thigh is. Then you actually need to measure around the calf area, the circumference. But then what is the distance from the thigh to the heel? Okay, so it'll have those instructions for you. And then once you get your measurements, you can decide, okay, they need a small, a regular, medium, or whatever the case may be. With the knee high, you see measurement from the knee to the heel, circumference of the calf. Okay, these are not intended to be loose on your client. They actually fit really snug, okay? And they can be a challenge to get on your client. So the client needs to be lying down with their feet, like this. Or if they are in a chair, at least have them prop their feet up for at least 15 minutes, okay? So when I go to put this on, one of the things I want to show you is I was working with someone one time and my patient care tech said, oh, the opening of the anti-embolism stocking always has to be at the top of the toes. No. You'll notice here for this particular stocking, can you see where that stitching looks a little different? There's a square area. That's the heel for this particular brand. So pretend that my hand's a heel. So if that's the case, if that's a heel, look at there. Look where the opening is. It's at the bottom of the foot. Okay? Let's look at this other. For my thigh high, can you see the stitch in there? So that's the heel. That's the heel area. So if this were my heel, you'll notice, look at this one. Here's the heel. So the opening is at the top of the toes. Okay. So when we go to put my stocking on, I want to make sure, how do I assess that client's skin? Because I want to make sure, do they have any skin breakdown? Do they have, open wound? Because sometimes the hose may be contraindicated. That means not advised. You'll see a lot of times it'll say turn inside out. I actually like to take mine and kind of bunch it. I have seen some nurses, especially those that work in surgery, they are all the time having to put these on clients because this is a protocol in many cases right after a surgical procedure. We just slip it on. Now these mannequins are made of rubber and plastic, so honestly they can be rather difficult for it to go on. And this one went on pretty smooth because it's actually kind of loose. But I want to draw your attention to a couple of things. First of all, let's see, where is the heel? So if I looked here, here's the heel. So that's in the appropriate area. Now, I do not want like cording or bunching because that could end up causing more harm than good. So I want to always be careful in straightening out the hose. Like don't come in and just start pinching like that because you may pinch your client. I'm going to have this so that's appropriate. Let's talk about the toes. Why do I have this opening? You know, sometimes people say, oh, it's so their feet can air out. Well, it's really for you to be able to look at circulation, what's going on here. So, a lot of times I've come in the client's room and this is what I see. Okay, that's not appropriate. Okay, does this allow me to see their toes? You betcha. So I can come check capillary refill, feel the temperature, I can even check pulse. But I want to make sure that in this case the opening stays here at the top. So it just allows you for that easy visualization to assess circulation there. Be mindful that these should be removed for bathing, because you do not want them to get wet during that process. If they're going to the shower or you're having a bed bath, you remove those and then apply appropriately. The other thing is, what are the cleaning instructions for them? A lot will say to hand wash and let them hang dry, air dry, because if they're placed in a dryer, to change the size with that. Always just check them, inspect them, because I have even seen clients where they said, oh, that fit me too tight. Well, remember, they're supposed to fit snug, and they actually took them and cut them. Well, that's completely not serving the purpose at that point. So as the nurse, you are responsible for making sure that their anti-embolism hose fit correctly. You may have a patient care tech that's going to put them on, but it's your job as the nurse to make sure, does that client have the appropriate size needed that has been ordered. So this will conclude the video for protective devices and anti-embolism hose. Thank you.